Good morning, everybody. Good afternoon, good evening from where you have joined to my presentation. Thank you for making your time at this in Dublin and also globally, whoever has joined via online. My name is Emranul. I'm from Concerned Worldwide Bangladesh, and I'll be presenting a health financing topic on a sustainable social protection measures for vulnerable urban poor communities, people living in urban poor communities in Bangladesh. It's a great opportunity to present my paper here in front of all the learned audience. Bangladesh is one of the South Asian country which is progressing very rapidly in terms of one of the economic indicator is GDP growth. With that growth, rapid urbanization is also happening here. The slides is showing that in comparison to other South Asian country, Bangladesh is running really ahead, even in comparison to India. With that GDP growth, so one of the driver is urbanization. Of course, we have got other drivers as well. I'll show those in my presentation later on. With that urbanization, so definitely the driving factor is economic growth. It will continue with the same pace as the GDP growth is progressing. A lot of economic activities are taking place at the urban center. Government would really like to take the opportunity of that GDP growth towards the urbanization. So you see the left side, there is a graph where it is shown that in comparison to other countries where Bangladesh is currently. So when urbanization happens, so what happens? A lot of people migrate to the urban area due to their employment opportunities, education, and other advantages. And also, definitely, there is a factor in this current crisis that is the climate change, impact of climate change. So that cannot be also ignored. Like we are facing river erosion, we are facing flooding, and those all of a sudden people who are living with the extreme poverty, so they are coming to the urban area because it is a situation all of a sudden they are facing, and for running their livelihood, for running their lives, so they are moving towards urban areas. But when they're moving, of course, the city is not ready. So they're not living in a well conditions manner, but where they're living in slum, in a low income area, and a very shanty area, and which is also contributing to their overall health and their also life and nutrition, other aspects as well. So as I mentioned that when they're coming to the healthcare centers or in urban areas, what is happening? So urban slum population is growing rapidly due to this urbanization, due to these natural calamities. They are coming here, but it's in comparison to other urban areas. So slum population is increasing in a double rate. And in a recent European Union funded project we have just ended, and we have seen that majority of them, more than 89% of them, are living in the extreme poverty situation, and one of the major barriers they are facing is the financial barriers, because I mean, for that reason they are not able to access the healthcare due to their significant financial barriers. And that is the one of the major dominating factors, and that is lagging behind to get the proper quality health services. But what is happening in absence of this adequate primary healthcare services? So they are not being able to go to the good quality facilities. It needs a lot of money, and they are rushing towards the government secondary and tertiary facilities for primary health. So it is overburdening those facilities, and government is also struggling to provide required services to the people living in the extreme poverty situation mainly. So this is the situation. So these are happening in the big cities and also small towns as well, where people are coming due to many other factors, as I mentioned, due to urbanization. So what we have found in this research. So we implemented a European Union funded project back in 2016 to 2020, and which was basically to support the people living in the extreme poor situation. Their social protection and their financial means can be protected via health voucher scheme and also via micro health insurance. So two options actually we try to test. And what we have found that over the project period, so we have given them purchasing power. So with that health voucher, so they are able to take free of cost services from the designated healthcare centers. And that actually saved them for any, like, if I give one example, like normal delivery, so childbirth, or any pregnancy-related complications, kind of services they got free of cost. If the health voucher seeking group, so they are going to the center and getting the services free of cost. And on the other hand, if the people who are buying the services from their own pocket, so that makes a huge difference, and that creates a kind of difference how they are protected and how this group are not protected. So we implemented this project in 4 big cities. So 2 cities in Dhaka North and Dhaka South. Another one is Chattogram, and another one is Mymensingh. So we have mainly tried to compare in Dhaka 2 city corporations and also in Chattogram, and we have seen that majority of those costs, like cost per household who are getting the health voucher scheme, so their cost has been very much reduced. So as you see, the cost per household, it was only 32 euro. So what we did, we have given the cards which enable them to get free of cost services. In Chattogram, we have seen the same, and it helped them to reduce that out-of-pocket expenditure. And another one is we have also implemented the micro health insurance model. So 2 financial scheme we have tried to test. One is health voucher scheme, which is they will go with the voucher, and another one is micro health insurance. With the micro health insurance, it's really important. Their coverage was a little bit higher, and they had to also contribute a little amount of premiums, which again, because we piloted, it was given from the project. So for the micro health insurance, they had to buy the product with a very minimal cost. And what happened? We have seen that with both the measures, they were very well protected from further expenditure, especially from their out-of-pocket. We mean it in health financing topic, that out-of-pocket expenditure reduced, drastically reduced. And this is the one of the you have seen the total out-of-pocket expenditure in Dhaka, Chattogram, both in micro health insurance and health voucher scheme. It got hugely reduced. So where we are seeing that in a nationally in the whole Bangladesh, so out-of-pocket expenditure is getting higher, like 70%. So most of the majority of costs are people have to buy there from their own pocket. But here we have seen with that financial scheme, they were protected, much better protected, so that there are other services, like they could. We did not go for further details what they did with the savings, but it's possible to track that with that X amount of money what they did. So definitely it protected their further needs, like education, other measures. So it helped them to get rid of poverty in general, we can say. But definitely it's this voucher scheme and micro health scheme is a social protection measures where they were much better set in comparison to other groups. So we did not do any control survey, but in general, we have seen that they were happy, and most of them, where they have told us that earlier they were not protected, but now they are better protected. So it is very much possible with the evidence we have got, and it was also, the paper was also published in PLOS One, and this cash-free protection mechanism, so be it voucher, be it microhealth insurance, they are much better protected. They are getting quality healthcare services, and also BRAC is our implementing partner, was our implementing partner in that project, and they were saying that even extreme poor, if they are confident, if they are happy with the quality of services they are getting, so they are ready to pay. So as a premium, and they are satisfied with the quality services. So it can be measures by the government in general. So as a social protection measures, and especially for the people who are deprived with the health or other social protections in areas in urban and rural areas. So in conclusion, so this is very, very important that both these schemes, any kind of scheme, health voucher scheme or microhealth schemes, these are cost effective. And these are sustainable because why all this projectile approach will not sustain. So there should be some mechanism from the government, and government has the responsibility, be it local government or the central government, they have the responsibility to protect this extreme poor, who are basically running the city. And from that protection mechanism, it can be a universal social protection for the urban extreme poor. It will build their confidence, and then their livelihood, and they will be much more productive, because without we cannot imagine a city where this group of people are not there, because the city needs it, they need them. So it's kind of collaborations, but their living conditions and their healthcare seeking behavior needs to upgraded and needs to be taken care of. And this is not possible just to build new PHC centers, thousands of PHC center, and country like Bangladesh. So definitely it will incur a lot of cost, which is not possible. But then city corporation in the big city and municipality corporation in the small town, they should come forward with this kind of mechanism. And from that European Union project, we have seen with this health financing product, be it health voucher or microhealth insurance, or we have tested another kind of product we call smart healthcare services, where we introduce the paperless and cash-free transactions, which was also very, very useful. So at the end, these are the measures could help them to achieve the universal health coverage, and also for the government to fulfill their global declarations like SDGs and universal health coverage targets. I'll end here, and thank you very much, and I'll be very happy to take any questions if you have any. Thank you very much.